25 minutes to now, you're listening to Morning Star. As I said, my guest this morning joining us for a very important conversation that has everything to do with our health, COVID-19, how we all stay safe. Nasira to Imoro and Jennifer Edubia Abuahin joining me this morning from the Regional Health Directorate. Good morning to you.
Good morning.
I'm happy you're able to make it before the rains began to pour this heavily this morning. I trust you're well and keeping safe.
By His grace, we are doing well. Please, what about you?
I'm also doing well. Thanks for asking. Before we even talk COVID, usually when the rains come like this, there's a concern about communicable diseases. Cholera being one, typhoid being the other.
Exactly.
What would be your general advice on the things we need to do to keep safe, especially with the rainy season that has come through?
Okay. Thanks to your listeners. We are happy to be here. Now that the rains have set in, there are a lot of precautions we have to take, ranging from what we eat to what we buy.
Okay.
What we eat, we'll talk about water, the food itself. We have to make sure we eat warm food. If the food is cold, we have to heat it. If it is water, we have to be sure of the source of water we are getting from. Now that the rains have set in, our source of water is very important because as it rains, there's flood here and there. Water is being carried from different sources to pollute our source of water. So we have to make sure the water we are getting is safe. If it is tanker water, as we usually patronize in Greater Accra here, we have to make sure our source is accurate. It's from the pipe. And if it is from other sources, we have to treat it either by boiling, by using chemicals that are recommended for water treatment. And our vegetables, we have to ensure they are being washed thoroughly with clean water and salt solution or vinegar to ensure that whatever germs that is on them is being washed away under running water.
There's a concern that's come up recently about even what's being used to grow our vegetables these days. So you may even buy, you may wash, you may use the vinegar, the salt, but there's still a risk.
Yes, but it's still better than not
doing all those things.
Okay. And then we also have some natural way of also reducing the chemicals, maybe by using charcoal powder or making sure you dip the vegetables or fruits in water for some time with the salt solution.
Yes.
It in a way reduces the chemical nature of
toxin levels.
Yes.
Okay. Even the sachet water that we're drinking, is all of it wholesome? Because I have a few friends who recently got to the hospital, told they have typhoid. Like, what? Me? Typhoid?
Yes.
Food from where?
Yes.
And they told, check your water.
Yes.
They said sachet water. Like,
Yes.
But if sachet water that a lot of people are consuming is bringing that problem, then really what are people going to drink?
Yes.
It's the brand or the type you are buying. So some I know FDA approves their production side. They investigate, they inspect, and they make sure that everything is produced under hygienic conditions. But we know in Ghana a lot of people are just doing business without thinking about the consumers. You go to an area, then you find out that there's a production house in somebody's living room. You will know. A lot of them are being produced and they are not supervised. Even though they will write something on it, you can clearly see that these people are not supervised. You go to some places, some of them that you buy have some smells in it.
Yeah.
And I don't know, people seem to like those ones. So we have to be careful with the brands that we choose. So that's
okay.
what
So be careful with the brands.
Yes.
So I'm guessing also that for the FDA, they should be regularly publishing water brands that are wholesome for consumption. Because if they don't, and these other people who are doing funny things and giving water that is bad, people are getting sick and they're not getting any respite for it. You know, typhoid.
Typhoid. And even with the how wholesome the water is, no matter how processed a water is, but the process of consumption can get it contaminated. For instance, the sachet water you mentioned,
Yes.
the person selling it might have gone to use the washroom without washing the hands
Ow.
clean with running water and soap, thereby coming back to use that same hands to remove the water and give it to you. You also assume that the water is sealed, forgetting that the person selling it hands has been contaminated with fecal matter that contains the bacteria that give us typhoid and other diseases. Thereby drinking it, you are indirectly consuming the fecal matter without knowing. And even look at our transactions, how we handle money. Somebody seated at the public toilet or wherever the person is receiving money, you go to use the money, and there's no sanitized place that you can wash your hands properly with soap and the running water. At the end of it, you use that same hands to dip into your pocket and remove the money to pay, or you use that same hands to handle your phone. That same hand, when you are eating granite or things that we assume you don't have to wash your hands. You know, certain foods are there. Most of the times, some people assume there's no need washing your hands, like eating fried yam, eating granite, eating roasted plantain, and the rest. Meanwhile, your hands are contaminated. So you eat these things thinking they are wholesome. Meanwhile, the process from purification to you consuming it is contaminated. So we have to be conscious about these things too.
Okay. All right. That was by the way, but very important considering the time that we're in. Yeah. People. Somebody would rush in. Oh, Charlie. Moko pick small. Yeah. That is trouble right there.
Exactly.
That is trouble right there. Anyway, I guess we can begin with our conversation this morning on the season we're in and the concerns coming up about COVID-19. I thought we were done with it. It is still with us?
It is still with us.
What?
Yes. Cases have started rising, and looking at how we started with 2 cases and where it took us.
Yeah.
And now cases have started rising to the extent that we have to start advising ourselves. It's like we've thrown our precautions away. So it is time for us to go back, pick up those precautions. If you're in a public place, you wear your mask. Wherever you think you are more than one, you need to wear your mask. We have to continue washing our hands with soap and the running water. We, those who haven't vaccinated, should make sure we get the vaccines. We, those who have vaccinated and leaving the booster, we have to make sure we get the booster. Because as time goes on, the system immunity goes down, and you need to add on to boost the system to be able to fight the disease. And we have to eat well, as which is also important. We have to eat food that will protect the body, not destroy it. Protective food like fruits and vegetables. Drink enough water, because as your throat gets dry, you sip in water. It is smoothing the throat, thereby reducing your chances of getting COVID-19.
Okay, so it means you have to drink a lot of water.
Yes, you have to drink a lot of water.
Yes.
Okay, but what's led to the respike of COVID in Ghana now? What's causing it? Do we know?
I think that's what she mentioned, that a lot of people relaxed and all that. And then there is also...
So it means it never left. It was
never
always
left.
here.
Yes, it was always here. And then I remember the last time we came, it spoke about the test to treat.
Yeah.
So as it was part of the routine services, as people go to the facilities, they were screened for COVID, and then some tested positive. Those who tested positive were treated. But of late, as we heard about last week, we realized that the cases were rising. So that's how come we are doing the 10th National COVID-19 vaccination. And not just that, in addition to Child Health Promotion Week.
Week as well.
Yeah, so we'll be vaccinating the children too. We started yesterday. So our nurses are going to homes. They went to churches. This week they will be going to the schools, especially with the children below 5 years, to vaccinate the children. So all those who miss their vaccinations, once they have their vaccination cards, they will give them the vaccines.
I see. Okay. Let's spend a bit of time and talk about the child promotion, shall we? Child Health Promotion Week. What is it about? What do you seek to achieve with it every week?
Child Health Promotion Week is a week that was established in 2004. It is meant to create awareness of childhood preventable diseases. It is also to bring on board stakeholders concerned to see to the need of we protecting our children, as vaccine preventable diseases are easy to prevent but difficult to treat, and there is no treatment for vaccine preventable diseases. The easy way and the safest way is to get your child immunized with the childhood immunization vaccines. And within this, the period of the Child Health Promotion Week, there are other activities that are being bring on board, like birth registration, awareness creation, reminding parents and caregivers of the need to still send their children to the weighing centers for them to be immunized with the vaccines that they've missed. Also ensuring that parents are being educated on the need for them to immunize their children and the importance of vitamin A supplementation, which is key till the child gets 5 years. So these are some of the activities that is being inculcated in the Child Health Promotion Week.
I see. And what's the theme for this year's celebration?
Healthy childhood. Invest in your child for healthy future.
Okay.
Yes.
And what are the raft of services that are being provided in this package for this week?
So she mentioned earlier that there is the family planning package for the parents, the mother who is coming.
Yes.
And then there is the growth monitoring, very important. I think the whole thing is about monitoring the health of the child.
Yes.
So we expect that the children are supposed to be brought to the facilities for their growth to be monitored. The growth monitoring is something that doesn't have to stop after some years. Mostly we've realized mothers after 2 years or 1 year, they stop going to the clinics. But WHO, per the standard, expects that a child must be routinely taking the child to the facilities till the child is 5 years.
Okay.
So from birth, once you give birth to the child, we start giving the vaccinations. And that one, every month, the child is expected to be brought to the health facility so that we will weigh the child against the height to measure if they are clocking all the milestones that are expected. And then from 1 to 2 years, you will be coming quarterly. Then from 2 to 5, then we do it half year, right?
Half year.
So that one, when you come every 6 months, they will give you the vitamin A. Then, so it's not after, usually mothers, once they tell them that maybe the vaccinations they are giving them, which is between 0 to 18 months, have been completed, they stop.
They stop coming.
But after that, we give the oral vitamin A. And not just that, you have to come for the nurses to assess your child and also give you the counseling that you need to make sure you are properly taking care of your child. A lot of mothers don't even know how their children are growing. Some of them, until someone else sees, or until it becomes severe. For instance, if a child is mild or moderately malnourished, you can't see with your physical eye. You have to measure the weight against the height to know those things. So we expect that the mothers do not stop attending the weighing services after 18 months. They should attend till 5 years.
So the weighing has to be done till you're 5?
Yes.
Yes.
So any child under 5 needs to go for weighing.
Yes.
So post 2 years, every 6 months.
Yes.
Yes.
I see. What if for the vitamin A and the rest, the parents are getting it for them anyway?
Yeah, but you still have to bring them for checkup. So you can bring them in, and then they'll be declared okay. And it will help you yourself. You know that you are doing the right thing. Yeah.
Because typically between 2 and 3 years, so when schools reopen, there's this seasonal, they will get sick,
Yes.
Cold, headache, fever, all those things.
Yes.
So all those things are assessed when you go for the 6-month
Yes.
periodic
Yes,
assessment.
Yes.
Oh.
And then educations that will be given.
Okay.
So per each season, like the way we've entered the raining season, the nurses will know what to tell you on how to care for your child at every season.
Okay.
And a lot of the information is even in the child health, the record book.
Yes.
Record book,
Maternal
yes.
and child health.
And then once you come in and sit in for about 1 hour, you get to learn a lot, which will help you and then your child.
Your child as well. Okay. And what are the channels for providing these services?
The channels for providing these services either static at the public facilities or the private facilities.
Okay.
Outreach, just where they move into the community, sit at vantage point where the community members know
Yeah.
they are, and then visiting schools. Just as you mentioned earlier, when the child attains 2 years, they are being enrolled in school and they are not able to go back for the immunization. Yes, so nurses do visit these nurseries to ensure that those who have missed their vaccination have been given. But what happens is, with the schools, we have challenge with that, where the school do not have the data of the child. It becomes very difficult for nurses to be able to know whatever immunization the child has taken and what the child has missed. So it is important from time to time. And as my colleague mentioned, it is not the first 1 year you'll be going monthly due to the vaccines that you need to take.
Yeah.
But after 1 year, you go quarterly. So every 3 months, just make a time, send your child to the facility or wherever is designated in the community to get your child screened to ensure that whatever the child needs, receive it. And after 2 years, it's half a year. The half a year is to ensure that the child is growing well. Whatever education or information the child and you yourself as a parent you need is given to you. What happens is with the vitamin A that is given, though somebody will say that there are a lot of food that contain vitamin A, but we do know that the process of preparing it reduces the efficacy of it, or the amount of vitamin A that the child needs. So this is a way of adding on to the vitamin A component that the child feeds at home, to add on to make sure the child gets the standard requirements of vitamin A.
Okay. In all of this as well, what are the importance and the benefits of vaccination?
Vaccination is actually very important. As we are here, without vaccination, we wouldn't be here, or we might be here with disabilities. You know what polio can do?
Yes.
It makes your lower limbs different from your normal limbs.
Yeah.
It makes you disabled. Thereby, either you'll be limping, one will be bigger than the other. But with the aid of polio vaccination, you get to realize that these things are no more in the system. And with the help of vaccination, we've been able to eliminate smallpox worldwide. And guinea worm, or other vaccines that are preventable, you realize that most of the diseases that we used to see, measles are no more in the system. Even if the child gets measles, it's in a mild form. And so many of the diseases that the vaccine prevents, it's either reduce the severity, even if the child gets the disease, it reduces the severity, and also it prevents the child from getting those diseases as well. So it's important. It's also save parents and caregivers time and money. If your child is not vaccinated and the child keep getting sick, every now and then you are at the hospital, you are spending money. This money could have been used for other things, or your time that you've been spent in the hospital during admissions or visiting the hospital, that time could have been used to generate some income for you, and it gives the family a happy life. When the child is not sick, the home is safe, the family is happy, there's no stress. Immediately a child gets sick, you see that the whole family becomes stressed up. Either the mom will not go to work, the dad will not go to work. You have to do a schedule for one to go, and so it's actually inconveniencing. So when the child is vaccinated, it helps. It helps in so many ways.
Okay.
And even Ghana as a whole, it helps increase productivity, because if the mother is taking days away from work, it reduces the productivity. So vaccination is key, and it's important to everybody.
Which vaccines are currently available in the country?
Okay, so for the children, we have all the vaccines that we give to the children, the tetanus, the oral polio one. We have all the ones that the children are supposed to take, the measles, rubella, all the vaccines, we have them. And then for the adults, we have Johnson & Johnson.
Okay, with the children right at birth, we give BCG and OPV0.
Okay.
That is polio, oral polio. So in 6 weeks, we give Penta, that is the pentavalent, the 5-in-1. We give rotavirus, we give pneumococcal, we give rotavirus. And then we repeat same in 10 weeks, and we repeat same in 14 weeks. And at 6 months, we give vitamin A, that is the blue capsules. And then at 9 months, we give yellow fever and measles, rubella 1.
Okay.
And then at 1 year, we give vitamin A, the 200,000 international units, the red capsules. And then at 18 months, we give the measles 2, measles, rubella 2, and then the vitamin A again at 18 months. And then pneumococcal conjugate vaccine, we give that one too at 18 months. So with this stage, the vaccines, the actual vaccines closes, and then we start to give the vitamin A every 6 months, like my colleague mentioned earlier, every 6 months till the child gets 5 years.
I see. And for the malaria vaccine?
Yes, the malaria vaccines add up to make it 14.
Okay.
Currently, but it is being piloted in 7 regions.
Regions at the minute.
And plans are underway to roll out to other regions as well.
Okay.
But currently, it is being piloted in 7 regions in Ghana.
So for the COVID-19 vaccine, is for persons what age and above?
It's 15 years and above.
Okay.
But currently, we have only Johnson & Johnson, which is for 18 years and above.
And above.
Yes, please.
Are there any side effects to vaccination?
Yes. So it is expected that once you introduce something into the body,
Yes.
there will be some reactions. So we have the normal ones that we always expect: the fever, the pain at the site of injection, the general body weakness. Some will lose appetite. Those ones we term as quite normal. But we have not really recorded extreme side effects of the vaccine. So those who experience these mild reactions, we expect that they report to the nearest health facility for care. And then some of the mothers too, when they bring their children, they know already. They are taught on how to do some home management of these mild effects. So that is what we have. As at yet, we have not reported severe effects that need drastic measures. We haven't yet reported.
As yet, okay.
Yeah.
What services are provided at weighing centers or the child welfare clinics?
Like she mentioned earlier, we have the growth monitoring.
Yes.
Where we use a scale to measure the child, use the length, we measure the length too. So depending on this measurement and the weight, it tells the nurses what to do. Either to encourage the mother on whatever the mother is doing right to continue, or whatever that information the mother give that seems to affect the child, we advise based on that. And then immunization are also given, like we mentioned earlier. We also give mothers the opportunity to also share their concerns, because it's a period that mothers actually bring issues that they face at home. So they are able to share with the nurses, and the nurses, based on whatever concerns they share, the nurses are able to advise on that. And if there is a need for referral, the nurses do refer to ensure that the child grow well and safe.
And then there is also free distribution of mosquito nets.
Okay.
Yes, and then I mentioned earlier we have the availability of family planning services. And then she mentioned that it's also an opportunity for you to register your child.
To register your child?
Yes.
Okay.
And it's free.
Okay. Can caregivers assess their baby's weight at home?
Yes, they can.
Okay.
They can assess, but you see, sometimes when you are involved, sometimes assessing and application of knowledge is something else. You know, when you assess something, you are tempted to apply emotions and judgment based on your understanding. But it is better for a health professional, even if you are a health professional, it is better for your colleague in that field to really assess the child, to give you a better advice on your child. But well, you can weigh your child at home, but it is better done and at the facility by a health professional.
All right. And what are the complementary food babies need to grow well?
Okay, as a baby is born, we encourage exclusive breastfeeding, only on breast milk for 6 months. No water, no dummies, no pacifiers like the things they suck. Nothing till the child attains six months. So when the child attains 6 months, the intestines of the child is assumed to be matured enough to digest cereals. So you start with cereals, fruits, and vegetables. But these ones, you have to mash them to make it soft for easy swallowing due to their immature organs. So you need to mash them. If it is yam, you mash with the stew or soup to make it soft for them to be able to swallow. If it is cereals, if it is cereals we use to prepare cocoa or banku or tuozafe, you need to make it soft. You need to add on vegetables, soups or stews that are soft, the child can swallow. If it is not soft, you need to mash it so that for easy swallowing, to enable the child swallow it well. And as you start feeding, immediately you start feeding, you need to be giving the child water as well.
Okay.
It helps in easy digestion. You need to add on fruits. It also helps in the child to be able to digest the food well, and the nutrients that is contained in the other food can be utilized by the body very well. So when the child is growing, it depends on each child. Some children will prefer the light one till some months and they continue with heavy.
Yeah.
Some children too goes
Heavier.
heavier. So it depends on the individual
I know some kids,
child.
they really like banku.
Yes. So you just have to observe what your child reject and accept and work at it. And then reduce spices as much as possible.
Okay, so the banku, a child eating banku is not a problem.
But it should be soft for easy swallowing.
Okay.
Banku with okra soup or the green. Oh, why not? Some kids they go straight with that.
That should be at what age?
That is what I mentioned, from 6 months going.
Hey, so 7 months child can be eating banku.
Oh yes, and they do, and they do. But at birth, no.
Of course not.
Because that their intestines hasn't been matured yet to be able to digest the cereals. Yes, but from 6 months going, the child can eat any family food that is soft and easy to swallow.
So banku,
less
tozafi,
spices. Yes.
kukunte.
Yes.
Okay. Fufu, very soft.
Very soft.
Okay.
You add on water, and then you feed them.
Bit by bit.
Yes, not with time. Don't use time to feed them, because in timing them, like we eat breakfast, lunch, supper, it's not the best. So you feed them more often.
So like
as and when
okay, so if for an adult is 3 times a day on regular, for the child should be how often?
Oh, it should be more. It should either be
5 or 6.
6, 7, depending on how easy the child accepts and enjoy the food. So the child will eat more regular than an adult.
All right.
Yes.
Okay. As we end our conversation this morning, what will be your final words to us?
Okay, I would like to say that this week is a week we have set aside to create awareness about these essential services that we provide for the children especially. So after this week, it doesn't mean that mothers should stay at home. If you miss it, go to the nearest facility and then get your child vaccinated or assessed. And also, those who are listening and at home or will be going to work, you can leave your, you can give the child's, those below 5 years, you can leave their weighing cards in their bags for them to take to school, because the nurses will be going there. Or if you have a relative at home, that you can advise them or give them the permission so that when the nurses come, they can provide the service for the child.
Okay. We know the rains are setting. Let's ensure whatever we are eating is safe. Whatever we are buying is safe. We should eat warm food. We should reduce cold food. We should make sure we wash our hands regularly with water, running water and soap. And then we should also ensure we receive our COVID vaccination, and make sure we wear our face masks whenever we are in public places. Drink more water. Those who are not able to drink water should carry their water in bottle or flask, as from time to time they will be sipping. At the end of the day, they will be able to drink the quantity of water the system needs for a day. Thank you very much for having us here.
And I thank you
to your listeners.
And I thank you too very much for joining us. We've learned a great deal from you. A lot to learn, a lot to understand, as we all stay safe and stay healthy. Thank you for your time.
Thank
for joining us.
Much.
That's Nasira tomorrow, the Health Promotion Officer, and Jennifer Edubia Bwahin, also Health Promotion Officer with the Regional Directorate of the Ghana Health Service, joining us this morning here on the Morning Star.